This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Is there a DPC clinician, tech vendor, or industry champion that goes above and beyond to further elevate the DPC movement? Nominate them for a DPC Innovation Award to recognize them for creating traction, embracing innovation, and demonstrating commitment to the movement. DPC Innovation Award winners will be announced and honored at this year's Hint Summit, taking place in Denver, Colorado, September 27th through 28th. Nominate a DPC innovator at summit.hint.com, plus get $50 off your Hint Summit 2024 registration with promo code My DPC Story. Direct primary care is an innovative alternative path to insurance-driven healthcare. Typically, patients pay their doctor a low monthly membership and, in return, build a lasting relationship with their doctor and have their doctor available at their fingertips.
Direct primary care means freedom to me. It means the ability to be able to practice in a more personal manner with my patients and not have so many people between us in that relationship, meaning administrators and health insurances. So being a direct primary care physician has allowed me to practice the way that I always dreamed of as a child. And so that in essence just equals freedom. My name is Dr. Joy Johnson Weaver, and this is my DPC story.
Dr. Johnson Weaver is a board-certified family medicine doctor who has been practicing for close to 15 years. After obtaining their bachelor's from Princeton University, Dr. Johnson Weaver attended Temple School of Medicine and then completed their residency at Chestnut Hill Family Practice in Philadelphia, Pennsylvania. Personally, Dr. Johnson Weaver enjoys spending time with their blended family of 7, coaching youth sports and reading clubs and gardening. They opened Resolve MD in 2018. Welcome to the podcast, Dr. Johnson Weaver.
Hi, thank you. Thank you for having me.
It's definitely my pleasure. Now, in your intro, you mentioned about how you envisioned medicine being a certain way when you were a child. So I wanted to open with that and have you explain a little bit more to the listeners. What did you envision when you were a child thinking about medicine?
Well, I envisioned having a very personal relationship with patients. And, as a child, I just imagined that I had time in my day to develop those relationships and didn't envision sort of the amount of paperwork and other non-medicine things that I would be doing, in the insurance-based world. And so when I say that sort of practicing medicine in the way that I did and the way that I envisioned as a child, it really was very patient-centered and not much of anything else.
And when you had that vision, had you been exposed to medicine in that your family was involved in medicine, or your vision came from your experience as a patient, or both?
I think it's probably some of, not necessarily family members in medicine, but I think images that I may have seen on TV, and then just my imagination as well, books that I may have read. It's all contributed to this vision of what I had of treating patients.
And when you were in your medical training in medical school and in residency, did you have any experiences that fed into that vision that you had as a child?
I think there were parts. I mean, when I rounded with or had some rotations with primary care physicians, especially ones that own their own practices, I think you kind of see what you want to see, right? And so I think I saw, this is a solo doc practicing the way they want, really developing these great doctor-patient relationships, and practicing medicine in the way they want. So I think I thought I saw that throughout med school and maybe parts of residency.
And after residency, after you had graduated, what was your path before opening up Resolve MD?
Yeah, so when I graduated from residency, I started at a federally qualified health center in Delaware. I trained in Philadelphia, in the Philadelphia surrounding area of Pennsylvania. So it wasn't too far to move to Delaware and practice. And I really did enjoy it. I really enjoyed the patients. The pace was a bit grueling. The paperwork is certainly a bit grueling as well. And then I practiced there for a few years and then transitioned to a more of a private practice with, 6 or 7 docs in Maryland. And, again, I enjoyed that. I enjoyed the patients. The pace I wasn't thrilled with. And so I transitioned to a practice where I was at actually for 9 years, a large organization, still in Maryland. I was a lead physician at one of the sites for 7 years and even stayed within the organization, went to another office that was kind of closer to home. And I found myself sort of starting to feel a bit like I was wandering, like I wasn't quite practicing in the way that I really wanted to, which started me sort of questioning, what were my next steps in medicine in general.
And when you started questioning, what were some of those questions that you had that you were seeking out answers for?
Well, I think each location, and I left obviously on my own accord. I mean, I'd been the lead doc in at least 3 of the positions that I'd been in. There's always this underlying current of why don't we have more time with patients? There was always something new that administrators were trying to sort of push on us that somehow they felt that we're more important than the patient, even though it was supposed to be patient-centered. This is going to help the patient, but actually it took up more of our time. So I didn't quite see it as being beneficial to the patient. And I didn't really like that controlling feeling. I guess I envisioned after going through so much training that once you're out of training, now you're out and you don't have people breathing down your neck. And that was just the exact opposite with the different positions I was in. And even if I didn't necessarily have an administrator breathing down my neck, if I was a lead doctor, they wanted me to breathe down another physician's neck, or a nurse practitioner or physician assistants. And I didn't feel quite comfortable with that either.
Definitely. And I totally hear you on that. It's so interesting that you say that so succinctly, though, because it is so true. Like when you go into medicine, I maybe not everybody feels like this, but I can completely relate. Like you go into medicine being so proud of every, procedure you've done in training, of every diagnosis that you feel really confident in treating. And then all of a sudden you spend your time at 3 o'clock in the morning charting because that's what you've been told that you have to do to get your paycheck.
Sure. Absolutely.
Now, as you were feeling these feelings, as you were questioning, as you explained, you were questioning, at what point did you discover DPC?
It really was in the last position I was in. As I mentioned, I was in a large organization for about 9 years. In that organization, it was about 40 minutes from home. And I think the commute was starting to wear on me a bit. And so I was transferred to an office that was closer to home, about a 15, 20-minute drive, more like 15. And I thought at that time that was one of the reasons why I was feeling burnt out. I thought it was the commute, because everyone was going through what I was going through. Every physician was seeing patients in 15 minutes. Every physician had administrators with new rules every 6 months or every few years and new contracts that seemed to take away more time. So I wasn't really questioning all of that. I felt uneasy about practicing. And once I moved to a practice where I was closer to home, it's like I'm making a good salary as compared to my colleagues in family medicine, for the amount of years I've been out of school, and the commute was easy. And then I just wondered, I'm still feeling uncomfortable. Like this is, I think this was my own evolution, just saying, something's not right. And I really started to feel uncomfortable with the pace. And I actually really started questioning whether I wanted to be a physician. And then that was scary because it's like, if you're like me, I have a lot of school loans and I'm thinking, what else am I actually supposed to do with my life? And then, I'd actually do like medicine itself and patients. So anyway, I was on a physician group. There's so many on Facebook, and probably grumbling with other physicians. And then someone mentioned DPC, and I was like, what in the world is that? And it wasn't the first time I'd seen it. I think I'd seen it a few other times and sort of ignored it. But this time I think I was open to knowing, hey, hearing, is there an alternative? And this person was sort of bubbly, and I don't remember who it was, which is kind of funny because now being a DPC doctor, I probably should know who it was. But then I joined the DPC community on Facebook. And when I joined, I was like, what is this group? Everyone's talking about their practice and how they're so excited and they're taking medicine back into their own hands. And I had no idea what I was reading for a while. And then I think someone had posted in the group, just if you're new, look through prior posts, get a sense of what's going on. And that's when I sort of realized, hey, this is a sort of an alternative way that could potentially fit.
That's fantastic. And I just think about, we'll get into these amazing points later about your practice. But, you are such an inclusive doctor when it comes to treating people where they're at. And I mean, like if anyone visits your website, which they should, you can clearly see that even if they don't know you yet. But it just kills me to think about that was even a thought in your mind that you might leave medicine because you just were not satisfied with the life that you were living in your career that you had prior to Resolve MD. So, for every patient that you've ever had, for every doctor you've ever talked to that you've inspired or helped a little bit along the way, like I am so, thankful that you did not leave medicine, as I'm sure everybody else you've inspired or helped is as well.
Yeah. Thank you. Thank you. I'm glad I didn't either. And I'm thankful for the DPC group as well. I mean, it's certainly life-changing to be a part of that community and to open up your own practice. My only wish is I wish I knew about it sooner. I really do.
Awesome. I'll probably pull that quote and put it in the social media because that's fantastic. Now, when you opened, can you share about your process to choose the name Resolve MD and about your lion logo?
Yeah, well, so I already felt like I had a life that was extremely busy. We're already bursting at the seams. You're up and everyone charts at a different time. Mine is a 5 a.m. charting. And it's like, you've got to wake up at 5 because if you don't, you're not getting through your charts. And then you start your day and you feel like you're behind. And they have this whole shaming process that goes on in these big organizations where they're posting if your charts aren't done, so everyone can see that, So anyway, my routine was to get up at 5 and do my charts and then get ready for work, maybe exercise and head out to work. And I have 3 little ones at home. I had just separated from I had just gone through a divorce in my marriage, so I did not feel like I had a lot of space and time. The kids are very active and working 40 hours a week. So when I realized I wanted to start direct primary care practice, it just took a lot of resolve. I mean, basically, like, you can do this. You are extremely bright. You've been through med school. If you can go through those grueling hours, not sleeping, if you've been through residency, almost sort of this pep talk. But I just, when I think about the steps it took, in addition to working a full-time job and being at the time, a single mom, that's all. It really was Resolve. And then I loved it because I love that Resolve MD came out of it, because then that word started to take shape with how I want to practice as well. So my resolve as a physician to take care of my patient members, and then the resolve that I hope my patients will feel from me and therefore feel towards working towards their own health. So it has all of those meanings for me. And so I was really happy to sort of name it Resolve MD. And it's funny when we're thinking of a logo, it's like, well, what's the animal that can go along with the word resolve? And, just choosing this lion, I just thought that, just sort of this serene, strong looking lion kind of just fit Resolve MD. And blue's my favorite color. So I had a designer kind of add blue to it. And there you go. That was it.
It's really unique, and the logo specifically. And I just think that it's very powerful at the same time. It's a very, what is the word? The lion is very proud looking. So right. I think you did a great job with it. Yeah. And I just love the backstory behind the name. I think it's so neat how, as physicians, it might not be a thing to think about opening your own practice, especially naming your own practice, because the trend, unfortunately, is to go into employed medicine. But I love that when I ask people that question, there's a reason behind each and every clinic name, and you get the chance to name your own clinic versus, go to a Dignity, go to a Kaiser, go to a Sutter.
Right. It's actually really one of the very first things I think that makes you realize you're on your way. Like you name it, and then it's like, this is your baby now. So you're gonna see it through. So it really starts to help everything else take shape. And so I agree with you. It's a very important step in the process.
Awesome. And so now I wanted to go back to this truth that you are so inclusive in your entire website, in your entire, the entire feel that it gives off. There's just so many aspects. And I loved reading into, the different pages that you had on your website. But I wanted to highlight your slogan. Your slogan on your homepage is membership-based family medical care, where our only focus is your health. And I just found that was really warm and welcoming, but also just pointing out to patients that you are our focus. But when I read that, I felt that it was immediately pointing to the fact that you are focusing your care on your patient's health. Right. And so I wanted to ask about when you were in the process of you'd named your practice, you'd gotten your lion. Did you spitball the slogan with your family or other people, or did this just come to you?
No, I think that one came over time, because I think most of us know why we're doing this, and we all have variations of that. When I say we, I mean, direct primary care physicians, we all have variations of it. And so I think, that one just sort of came over time. I don't think I've passed it by anyone. It just sort of made sense, right? Like that's what we're doing. And what's interesting is it came over time because you get so many calls in DPC. In the beginning, new members are like, wait, I just reached you directly. Like they're almost surprised, right? Or they're just surprised at some of the nuances of the care. You almost start to forget, but you're providing this level of care that's just so much more direct, right? That when, the more I keep thinking about it, it just made sense to say that's exactly what it is. My focus is not coming into a room and clicking 10 boxes and wondering how I'm going to get through my charts. My focus really is to just sit and listen to you and kind of go through things for as long as we need to. So, again, I think it just kind of made sense, and it has come over the few years that I've had a practice open. It certainly wasn't the first slogan on my page.
Gotcha. But it's cool that it changed with your practice. Like as we all, hone in on our way that we do things or the way that we like to do things, you had your web page change with you. I chuckle though at when you mentioned that patients were like amazed that they were getting you as their doctor on the phone. Right. Because I remember Dr. Lauren Hetty, when we were communicating about when to schedule her interview, I only could message her and I didn't have her phone number. But then knowing that that's pretty much how everybody works, I just called her clinic number and I said, hey, I'm guessing it's you on the other end of the line. So that's awesome. Right, that's awesome. Right. Absolutely. Now, another thing that you have on your website is a video of you where, as you watch the video, one of the things that you say, another inclusive statement again, we allow patient care to exist between you and I. Mm-hmm. And so I was wondering about that video in general. What was the thought process behind I would love to have a video on my landing page, basically. And what was the process like developing what you were going to say in that video?
Well, I think that I wanted people to meet me before meeting me, because I find that people don't quite get this, right? I'm paying money for what? And you can say it, but they don't always quite understand it. And I wanted to take maybe some of the mystery out of it by hearing those words come out of my mouth. And I do think in that respect, video is more powerful than just what you've written on your website. And so that was the thought process behind that. There's got to be somewhere in here where they can click and see me speak. And I wanted to exude this sort of openness. And then I wanted to have the clinic in the background. I just wanted to make it real. This is real. This is where you would be. And this is who you would meet and see. And so, and then, again, stating this is care between you and I, because as we know, every patient is different. You may have a patient with the same diagnosis, maybe the same body weight, same ethnicity, all of that, but they're still you're going to meet them where they're at. This one might be squeamish about this. This one might be very gung-ho about treating this, and so I just need people to know exactly what I said, that this is going to be a relationship we're going to develop. I'm going to get to know you. And then we know how to move forward with treatment.
I make accompanying blogs that go with your interview. So I've written down that I'd like to put the link to your video there. Your website's going to be there also, but I love like when people can hear your podcast and then watch the video. That's like things that we're talking about in the podcast. Yeah. So especially after 2020 and everything that this country went through, one of the things that you have on your website is your oath against racism. And I'd like to ask if you can share with the listeners, what exactly is that? And is it something that you're able to discuss with patients now? And the reason I ask that is because prior to maternity leave, I got I'm so anxious about what's going on in this country. I can't sleep because of what's going on in this country. I got a lot of those patient concerns that we had to address in clinic, where normally these patients who are asking these questions did not have any concerns like that they had brought up with me. So I'm wondering, has this oath against racism opened up a level of communication with your patients that you had not had before because you have it on your website?
It's interesting. I'm actually going to say no, which is probably not what you thought I was going to say. The oath is there so people know that I know that racism is a public health problem, right? And we don't address that. We do a really poor job of addressing that as physicians. We do a really poor job of addressing racism in general. And we have to, because to not say it is really doing a disservice to everybody who's suffering from it. And the importance of meeting people where they are is having an understanding of them. And so that oath is there for someone to see, to say, my doc gets it, period. 2, it's for physicians. If anyone goes on my site, I want them to see we should be addressing this. And if we're not, we're doing a disservice to our patients. It's not okay to say we love everybody. You have to address the problems that we see. Just as we may go through screening questions for domestic abuse if we think there's a high risk, sexual abuse if we think there's a risk. Racial trauma is real and it affects our patients. So it's there for patients who haven't dealt with racism, patients who are not people of color, for them to see this is what I stand for. And I love the fact that it's my practice and I can put it on there and no one can tell me you can't place it there. But again, in one part, it's for patients, but the other part, it's really for physicians too. I want physicians to see it should be on your page. And if it's not on your page, you can address it any way you want. It just needs to be addressed somewhere. And so it's great that you had patients who were coming to you and actually saying to you that they were nervous, because that means they were comfortable enough to tell you that, right? There are patients of color who aren't comfortable enough saying that, but yet it's still going to come out in their health. It's going to come out in noncompliance. It's going to come out in anxiety and depression. It's going to come out in a myriad of ways. So again, if we don't address it, then we're really doing a disservice to the people that we take care of.
Yeah, I agree 110%. It just, as a Filipino doctor, seeing, the recent incidences about, violence against Asian Americans, I think about how, not just about Asian Americans and the experience that has happened in terms of violent experiences, but just in general, when we look at COVID vaccination, voting access, I mean, these are, when you talk about public health, if we don't have a voice equally for everybody, then we absolutely have a public health issue.
Absolutely.
So as we're talking about the oath against racism, I want to go into a question that's more focused on LGBTQ care, because I feel that in terms of public health, and given that we're talking about DPC during Pride Month, I want to ask, what are some of the issues that you have seen, physical health as well as mental health wise, when it comes to people who identify as LGBTQ in your practice?
So there are going to be similar issues to any group of people that have felt marginalized in this country, people who feel like they're not seen. And so it's similar to racial trauma. Obviously not the same thing, but there's similarities where people come to me, and because they know and see immediately that this is an inclusive space, there's a comfort level. They're saying things that they may not have said before, or they're actually starting to come to the doctor, which honestly, I have quite a few people who have come to me and said, we have not been to a doctor in years, and so we're excited to have found you. And honestly, they are like every other patient. It's just that they feel comfortable with me. So now they're going. And sadly enough, it's because they've probably had relationships with doctors where they've been insulted. And that's why it's really important for us as docs. Again, we can't say we're welcoming, we love everyone, we treat everyone the same. We actually have to do the work to learn about other cultures, other people with different sexual orientation, gender identity, racial groups, because you can offend people without knowing it. You can offend people with your unconscious bias. So you've got to task yourself with learning those things. So, and I've offended people. I do not want to sit here and say that I haven't. I certainly have, but I like the fact that I'm pushing myself to continue to learn. So, I mean, specifically with the LGBT community, and I'm queer. I'm a gay physician, so I feel like I have more insight than others. And definitely not exhaustive and complete for sure, but there's certain things that I may know to say about certain things. I mean, this is just one example, but for instance, if you have a person who identifies as a woman who is a lesbian, so and they are masculine leaning, sometimes issues surrounding the breasts are uncomfortable to them, and so you have to sort of kind of get that, right? I mean, if you have a good relationship with them, they might express that to you, but others, you may kind of already know that this is going to be a bit sensitive. And I'll try to be just kind of straightforward, but also a little relaxed and say, hey, you can't ignore them. We know that it's not the most comfortable for you, but we still got to take care of them. I may say something simple like that, just to sort of acknowledge that I get that it might be a little uncomfortable for you, but we still have to address this, right? I mean, that's just a very small thing. More and more, I'm trying to understand and learn about trans care and gender identity, making sure I use proper pronouns with clients. I mean, something as simple as addressing a person by the pronouns that they are makes them feel welcome. The care from there might be the exact same care you're giving everybody else, but the fact that you've taken that moment to address them properly, it just makes a world of difference. And honestly, that's something I didn't know maybe a year and a half ago. So, I mean, we all have to keep learning. It's very important, but I do think there are some nuances. And so it's important to kind of try to open yourself up to reading and educating yourself. Join a group, anything. There's plenty of resources.
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes.
Awesome. And, going back to that statement of how you would address a situation, like it might not be the most comfortable, but we got to get through this because it's obvious. And I'm still here with you, even after you give me an answer. I just think that that's so awesome. I mean, it just, for those people, it just breaks my heart that yes, the marginalized lack of, hesitancy to get healthcare sometimes in those populations who are marginalized. It's so heartbreaking because of preventable diseases that have gone past the prevention point. And when people end up in emergency rooms or urgent care centers, there could have been a lot of changes made prior to those visits, where if a physician were able to be there for that patient at those early stages where prevention was still possible. It's just terrible that there are cases where bad health outcomes could have been avoided. So,
Absolutely. We can, I think we can do better with that. We really shouldn't have a trans patient coming and saying, yeah, I haven't gone to the doctor for 5 years because I was misgendered in the clinic and I was made to feel uncomfortable. I mean, it's just, it's a travesty. We really have to do better so that our entire, our entire nation is healthy, right? We're only doing as well as our most marginalized folk, so.
Yeah, so true. And when you were talking about constantly educating yourself, that's one of the reasons why I wanted Pride Month to be focusing on inclusivity and the doctors doing inclusivity, including yourself, because I feel that learning and just keeping your ears open and your heart and your mind open to, this is not like the way I do medicine is not always the end all and be all. Like, for instance, in the questionnaires, I was very used to, do you have sex with men or women? Mm-hmm. And it wasn't until residency that I asked about, or both, like that. I mean, just the idea of that, having that as a simple change in how I asked a question, especially to teenagers. I've gotten a lot of more information out of teens when I ask that, especially when it comes to people who are exploring both types of relationships. So, I mean, I totally hear you. And I hope that resonates with listeners, because medicine is always changing. We are always changing every day. We are a day older. And so I feel that is so important to keep in mind that, there might be a better way out there, might be a different way, or might be a little bit of a way to adjust how you're asking something to be more inclusive and affirming. And on that note, I wanted to highlight on your Facebook page, you had posted this amazing post where it was about somebody who had seen their teenage at the lunch table. And the comment was, I'm so proud of my teen because they're sitting there at the table with their friends practicing correct pronouns.
Oh, right. Yeah. It's so important. I think we do better. You can do, I forget the quote that it's Maya Angelou where she says, do better once you know better. Right. So I messed up. I mean, I had a patient who was trans, and I thought immediately, because they were trans, that they wouldn't buy the pronouns he, him. And I'm sitting here proud of myself. This is, trans patient, he, him. I misgendered this patient for a year. And this is in DPC. So this isn't even the excuse of I'm rushing. I was learning more about pronouns, and it dawned on me, I never actually asked this person Turns out they actually go by the pronouns they, them. It's because I didn't ask. And that's what I'm saying about us as physicians. Like, if we don't ask, we're in positions of power. We cannot assume that the people we are treating are going to offer this information. But they will they may consistently allow themselves to either be misgendered, or something may be said that insults them, or they're misunderstood, and you think you're doing the right thing. This is, I think, we're constantly educating ourselves. As soon as I found out, I asked my patient. We switched the pronouns, and I'm trying to be much better about it, just in general. And what I'm starting to learn is I really should, across the board, just have everyone's pronouns. That way we are normalizing it, and we have less of this chance of misgendering folks. The generation that that's coming after us, they're doing it right. They already know this. They know these things, and we can learn from them. To stay where we are, we're going to be dinosaurs. We're going to this fixed mindset, and it really doesn't help anyone. It's just that's the way I look at it.
Absolutely love that. I absolutely love that. And on that note, I want to ask, when a person is onboarded as a member patient in your clinic, how do you identify their gender, or how do you have a patient identify their gender to you?
Well, I developed a intake form for all new patients. So it's going to go through those SOGI questions, the sexual orientation, gender identity questions. But I find that that's not enough. That was okay when I didn't have staff. I have staff now. And so I feel like I'll remember when I see that. And then my electronic medical record elation has a place for pronouns, but it's not easily visible. And so you can really easily, not use the correct ones. And if you don't ask, I mean, again, I have countless stories of how, if you don't ask, if you just assume, you really are making a mistake. Even with sexual orientation. I mean, there are patients that I might even think, if I ask this, I'm going to offend them. And it's such a wrong way to think. You got to ask, because you'll be surprised at the answers, So anyway, it's really the intake form as the SOGI questions. And now I have started actually this week putting the pronouns right by their name. So it's nice and big and visible, because I have staff. I've gotten staff over the last few weeks, and I realized that we just have to do this as an organization.
And with your staff member, is it singular?
It's plural now.
Oh, okay. Yeah. With your staff members, do you have a discussion or a module of training, or how do you get them to also be inclusive and conscious about pronouns, proper usage of pronouns, and trying to everyday improve on usage of proper pronouns?
Yeah. So it's interesting. With the first staff member, I just was very clear about it, mainly because my pronouns are they, them. And I want that to be, used correctly. And this staff member is so wonderful. She now uses they for everyone until they tell her otherwise. And what she's found is it just helps her, to not sort of, misgender folks. And I just thought it was wonderful. And so now, with new to my practice developing staff members and bringing on the staff members, I realized we should all go through training. But we did talk to them. When we onboard them, I've talked to them about it. And I'm really, I would like to talk about other things and sort of go through some formal training for a few other things as well. So I think it's just necessary.
And in addition to the Oath Against Racism, you also have a page, Pronouns, with the link at the bottom to pronouns.org. Mm-hmm. And I wanted to ask, have you found personally any particular resources in addition to pronouns.org that function in terms of teaching or educating people about proper usage of pronouns that you love referring people to?
No, I don't have any one thing. I honestly say Google it. It's just, there's so much information, and you can read tons of information. It's very easy and at your fingertips. So I haven't really had to refer people two things. But if I did, I would say Google it.
Yeah.
Yeah.
And I was just checking out pronouns.org in preparation for this interview, and it's pretty amazing. I love that it gives also, I think, like 6 different examples of empowering ways to address if you're mispronounced. So it's not only education about how to use correct pronouns for others, but it's also about speaking up for yourself when you are mispronounced.
Yeah.
And I thought that that was so interesting because it sort of ties into, you also had a post somewhere about the book, Your Name is a Song. And I think that, just the idea that we're talking about being inclusive and being and addressing public health through being aware and being actively educating ourselves about how to be inclusive on all different levels. I feel that people using the incorrect pronoun, people using the incorrect pronunciation of name, all of those can absolutely create barriers between you and your physician.
Oh, sure. Absolutely. Yeah. And then sometimes, it's done purposely, and that's not great either. People can feel that. So these are all very important things for us if we say that we respect our patients, and they may seem very little to people, but they're not. I've had some really bad experiences with doctors myself on a personal level with family members, and to see that is heartbreaking because I have the knowledge, the wherewithal to combat that. I can throw on a badge or say, hey, I'm a doc, and immediately the demeanor changes. Not everyone can do that. And that, again, like we said, is going to make them either not come back, or they come back, but they don't fully trust you. So how compliant are you if you don't really trust the person that you see? And so it becomes a really bad cycle.
Absolutely.
Yeah.
Now, in a scenario like DPC, where potentially you are opening a DPC in a community where you, like, a doctor might know nobody in that town, if they're moving to that town, quote unquote, cold turkey, and opening up a practice. And let's say a new doctor to a community is using a pronoun like they or them, but is also fearful of, I guess, a new physician who might not be so comfortable with using their own pronouns correctly, and who's also balancing, I need to appeal to patients to try to get them to join my practice.
Sure.
I just wonder, as a person who is using they or them yourself, how would you advise a person to, be in that space, be comfortable with that space, and get through that space to be empowered to use the correct pronoun for themselves, as well as be able to, not necessarily worry so much about pleasing others to get them to join their practice?
Yeah. I can't tell people what to do, but I will say this. My pronouns were not on my page when I first opened. This is an evolution of me personally. And the evolution is not just of evolution of my gender identity. It's an evolution of expressing who I am. And I've gotten to the point where I know how very important it is to express who I am. When we shine, we give permission to others to do the same. And the very first day, I changed my website, and I can't remember how long it's been now, maybe a year. Before I hit publish, because I do it myself, I asked my partner, I said, oh my God, I can't believe I'm about to do this. What if I lose patients? People are like, what is this? How much criticism am I get? And which is kind of funny, as if there's thousands of people checking my page out, and that's really not the case. But still, it's just like, you feel like you're exposing yourself. And I said, maybe this is too personal. We're talking about medical practice. Why do they need to know about me? And my partner said, you have to do it. And we know why. And we both know why. We are talking to the kids in the back that might not want to say that they're queer. We're talking to, other people for whatever reason. I'm just using the example of being queer and not being out or being afraid to come out. But there's a ton of other reasons that don't necessarily have to do with that. When I hit publish, the very next day, I got a call from a person who said, I saw your website. So this is about as random as it gets, right? I saw your website and I just wanted to call and say thank you. I have never been on a website where I have seen this type of openness to being gay and using pronouns. And I mean, this woman was going on and on. She said, I have a daughter who is bisexual, and I can't imagine, I just can't understand. I'm so astonished to read and see a doctor actually being this open and welcoming. And I just wanted to call to applaud you. She wasn't even calling to be my patient. She just wanted to say that. And it was the very next day. It achieved what I wanted it to achieve. So it'll always be there. If you're another physician wondering whether you're going to get patients, none of my patients left me. The ones who don't understand it just don't understand it. That's fine. There are ones who do, and there are others that have joined me because of that. And that's what I want to be. I want to join. I want to develop a community of patients that feel like it's home. And I know displaying who I am allows that, right? Because if I'm inclusive about this, it's not a far stretch to say that I'm inclusive about a lot of things, right? And so this doesn't stop with gender identity, sexual orientation, and race. It's with everything. I had a woman who is obese, and she called me and said, your site, it's amazing. I don't like doctors. I haven't seen a doctor in 3 years, but reading your site has made me think this doctor could be open to me. I've been treated really poorly because of my weight. So we started talking about that. So it starts the discussion. And if that's what my practice is made up, then I'm a happy person, you know? So, and then I would say, you know, you have to make the choice. If you're in a community where it's dangerous, okay, well, you know, maybe I'm not going to out and tell anyone they have to be out. I would never do that. But I do say that we are in a position that's better than most. And it just could support someone else who really needs it.
And I think it goes back to, first of all, that's amazing. Thank you. Thank you so much for saying that. I also think that it goes back to what you said about the younger generation, and they know what's what and what's going on. And I think that especially at this time of just awareness that this country has gone through, that if there is something, you know, that anyone has a question about, there's going to be somebody else who's having that exact same question. I mean, just as you went through that example and explained, like, you're not here to tell people, but you can give your experience, and if they can learn anything from it, great. And I think that that this is where people like yourself, people like Dr. Mohammed, people like Dr. Eamon, there are multiple even DPC clinics out there where inclusivity and how to be inclusive for, well, I mean, let me restate that. They're pretty much like, because DPC allows us the freedom to practice medicine as we choose to practice it. I feel that just being inclusive is an easier thing to achieve with the time and with the, you know, the smaller number of patients a person could potentially have. So I would definitely encourage people to, if they have any question with regards to how to address obese patients, how to address gender related questions, reach out to somebody if you're not sure.
Sure. Yeah, absolutely.
Now, I want to ask about your practice with the pandemic. Did you experience any changes in your practice at all during the pandemic?
Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad.
I think it was very minor. I think the shift was people didn't want to come in. So we did even more telemedicine than usual. I had some, 10, 15% who were struggling a bit financially to the point where they asked, could they stop paying for a little while or have a discount? But other than that, I know I lost some patients because of financial issues probably, but I gained some as well because of poor access to other practices. So I pretty much stayed pretty steady. I definitely wasn't a growth period for me, which I think some people might have said, well, I grew, I'm a new practice and you want growth. But I didn't experience that huge boom. So, but we're doing fine. We're where we want to be right now. And we've taken on a lot with COVID testing as well. And maybe trying to be a practice site that also gives the vaccine. That's been a bit tricky, but hopefully that's coming as well.
Definitely. I know that's a statement that many people can relate to, especially with more shelf-stable vaccines being available to everybody. Now, another quote that you had posted was, "Science is not the truth. Science is finding the truth. And when science changes its opinion, it doesn't lie to you, it learned more." And I want to ask about misinformation, because as a DPC doctor who is inclusive, who has more time, how have you combated misinformation since this pandemic started?
Yeah, it's interesting because I think in DPC, the people who may be drawn to us also may think that we're docs that sort of don't practice sort of the traditional traditional based sort of medicine. And I constantly make people aware that I'm not really, while there are certain things I've learned in my career about alternative medicine, that is not my strong point. So people may come with a lot of different therapies that they're interested in and thinking that I would be very open to. And while I'm open to learning, I still kind of have to combat some of the things that I hear. I think that quote I probably pulled from Dr. Borgia at Radiance Medical Group. I think she had posted it as well. But I posted it specifically because I had people talking about their concerns with the Johnson & Johnson vaccine and how it had been pulled for a little, I think it wasn't a very long time that it had been, everything was halted with giving it because of the issue with clots. And people were saying, see, this is what we expected. We knew there was something going to happen with this vaccine and they hadn't tried it long enough. And here we are. And, I love the quote because it said, listen, we're evolving, but we're not trying to dupe you here. This is, we're evolving and we're holding the vaccine to make sure that what we're seeing with clots isn't an enormous number. And, obviously, as it turned out that this is happening at even a lower rate than in what it would in the general population. And so giving the Johnson & Johnson vaccine continued. My quotes are out there on my personal Facebook page because a lot of my Facebook friends are people of color and I really hope to reach them. I want people to get the vaccine. I think people of color are probably not probably. I know for a fact the percentage we're not getting it as high as even sort of our white counterparts. And that's a travesty, seeing as we are at higher rates of dying from COVID and higher rates of being hospitalized. And there's financial insecurity being sick. And even if you're sort of sick at home, that's still a problem. So, I just try to throw things up once in a while to maybe reassure people and hopefully give them some confidence around the vaccines.
You bring up another point in terms of, marginalization, looking at patients who are Black, patients who are brown, patients who, because of socioeconomic status, don't have access to care or access to quality care for a multitude of reasons. So when we look at even the statistics in medicine, when it comes to Black physicians, the percentage is lower than 5% of practicing physicians, which to me is disgusting. As a person of color, I just feel that, that for me, it's, oh, are you a nurse? Because you're Filipino and Filipinos are always nurses, right? So I wonder, in your experiences in your career, were there any outlets or resources or conferences or ways that you found exposure to other Black physicians that helped you feel empowered and helped you get to the place where you are today?
Oh, absolutely. I mean, you start one with a strong family base, which I had. Very, very fortunate to have an extremely strong family base. And then you seek people out that look like you. Not because you're trying to be exclusive, but because you need comfort. You need people who are going to be going through the same thing you are. And we did. We pulled each other along. That started in college. I went to a majority white college. And sure, I had friends that weren't of color, but they also were not going through the things that I was going through. Sometimes just the fact that you would be, first generation in an Ivy League school, or, some of the racist things that your professors would say. I mean, some of the things the professors would say, just shock you. And then, of course, the students and things they would say, or the things you had to go through. You needed to find people who understood that without having to explain it. And so that is an immediate thing that I've done. And I would say many people of color have done throughout all of their schooling. So through going through university, med school, I always had a strong network of friends. And then there were always a group of people 1 or 2 grades above you that were there to teach you as well. Now, it's not large, certainly not large in any respect, but it's there. And we all knew the importance of reaching back as we became upperclassmen. And it's just the way it's been done for many, many years, because it has to be that way. So that's where you get your strength and your power. You get it from your community. My community was my family. And then my community was my very small group of friends in each level of getting through what I had to. And I'm an athlete too, or I'm a former athlete. And so I have this internal coach that is like never really quiet ever, sort of pushing me as well. But so that allows me to sort of go in the room where there's no one that looks like me. That allows me to face the racism that I feel all the time. As you mentioned, as being a Filipino physician, you meet that on a regular basis. And it's not that it doesn't hurt. And, I think we all probably at some point need to really recognize that it's racial trauma, but it's there and we can deal with it because we have for so long. Absolutely.
And I'm glad that you said that, because also for any listener who might not be of color, it's just, this is where I feel like I think back to 2020, like just educating ourselves about each other's experiences is so invaluable, because everybody experiences life differently in general, but especially when you throw a marginalized component to the mix, it's like, oh, okay, that's a whole different ballgame.
Right. Yeah, absolutely.
Now, what about the fact that you are a part of a family of 7, which is a very big family? How do you balance your life now with everybody running around all the time?
Yeah. I don't know if I can say it's balanced. It's like I come from a family of 5 children already. So, and I talked to my dad. So my mom passed away. So I talked to him often about things. And I said, how did you all do it? And, we talk about just sort of juggling balls in the air. So it's not as if it's balanced. It's like throwing a few balls up and you're like taking care of the most important ones at the time in that moment, but knowing those are up and slowly coming down, and that, you've got to make a plan for those and maybe be able to throw a few up. So that's not so much balance, but a juggling act. I think I'm also very fortunate. I have a wonderful partner. We blended our family, and I think we do very well. We play off of each other's strengths, and we have really great kids. At the core, they're in their teen years now, and that's a challenge for anybody. who's raising genes, but really they're really good kids at the core, and really, they do well in school, and I think that helps. We're fortunate in that. So there's periods of time, I think, in DPC that they're going to be busier than others. I mean, maybe all of a sudden you've got a group of new patients, or you've got some business aspects of DPC that really need to be focused on. And those are times that you really aren't doing great at home with all of the things that are happening. And then, maybe things shift and you're needed more at home. I love with DPC that I have a little bit more freedom to at least handle things the way I want to. In the insurance-based world, larger practice and organizations, there's this huge guilt for calling out or needing time. Whereas with DPC, you can just sort of rearrange your schedule if you need to. You're the boss, and your patients are extremely open and flexible, mainly because you're taking care of them very well. So they don't think that you're dodging them if you say, hey, I can I shift your appointment, or I have to close the clinic for a half day or something like that. And so that's been a wonderful aspect of owning my own practice.
Now, I want to ask on that note a little bit. I want to delve into some details about Resolve MD. And one of the things I wanted to ask about first is pricing, because your pricing structure, kids start at $79 and then adults are more than that. How did you develop your pricing structure?
Well, so the pricing structure actually recently shifted. And it was lower. But I think now that I've been open a few years, there's a shift inside of me. And I don't know if everyone goes through this at some point. Really, the pricing structure has to match your area. There are areas where you can have a low pricing structure, and that means you're going to get a good number of people. Maybe there's not great access to healthcare. My area, there's great access to, there's a lot of doctors. We're not in an area with a lack of physicians. There are a lot of people who have government jobs because we're near DC and major cities. And so that's also great insurance. Doesn't mean great healthcare, as we both know. And so people don't quite get why they would pay an additional fee. And I also think that I am in an area that has a higher income than some areas in the country. And so I've learned a few things. That one, with the lower pricing structure that I had, which is probably one that many people sort of start out with DPC, $25 for a child if they sign up with family, $50 if they sign up alone. I capped at $75 for adults. One, I wanted to make sure people, at this point, I want to make sure people understand that I'm legitimate. And I feel like sometimes the lower pricing, people are kind of like, well, why is it so low? And one, why am I paying for it? But two, if I am, why is it so low? How is this doctor how is this doctor surviving on low prices? And I felt like it sort of devalued me in general. So I increased the pricing structure. Two, there gets to a point where when you're doing so much for a patient, I want to feel that. I want to know that I am making the money that's worth it. And while I enjoy this way of practicing, there is a very real part that I want to be a viable practice down the line, where I'm not working so hard that it now becomes another piece that I resent, and really do value my time more. I know if I sit in a room with you for an hour, my price should probably be higher. And if I have to give a discount to some people who can't afford it, certainly I'm going to do that down the line. But in general, I do think DPC, we should probably be charging a little more than what I'm seeing. And I'm probably not at a high tier, but I do like my structure now of the $79 a child, $99 flat fee for everyone else, and then over 65, I believe I'm at $149 right now. I think that is fine. And as I said, I'm happy to give discounts, but I do value my time. I don't think it's concierge pricing. I still think concierge is much higher. And I think we do a lot. We do quite a bit. And there are plenty of people who will pay that price even as a retainer. They might use me a few times through the year, but they know when they use me, I'm there. They're not calling out to wait hours for their doctor. They have me and have great access to me. So I'm really happy with the structure. I feel really good about it, actually, now that I've put it up over the last month, I believe.
Awesome. When you talk about pricing and changing your pricing, I want to ask, how did you handle the change? Did you have any second guesses about, what exactly am I changing it to? What am I going to do about the patients who are paying at the lower rates? How are they going to take it? What was going on between when you thought about changing prices and you actually changed them?
Yeah, I think, again, it was just the idea that I'm just valuing my time more. The prices of like my EMR went up. I brought on staff and, you kind of think about it, but there's other things now you have to pay for with them. We've got inflation. So I was thinking, boy, I've been open for 3 years at these prices. It's time for them to shift. So what I had done is I actually said, well, I'm nervous about shifting these prices. Let's keep all of my old members at the older price. And I was having an influx of patients because of a close of a practice. I said, now, and we'll have a higher price as the new ones come on. It was just a mess. For a few months, I had 2 pricing structures, and I said, you know what, this is silly. And I still, the newer pricing structure was still a little bit too low for what I was projecting to take care of the changes in the practice. So I wrote a letter saying, for 3 years, the price has been the same. It's, with inflation and the changes in the practice, and to remain a viable, strong practice that provides the quality care that I provide you, this is the new pricing structure. And in my mind, I said, if people have to leave, they have to leave. Because I think there's a point when you value your time. And I didn't want to get into a situation where now I'm either solo or just one staff member doing just as much work as I would in the employed world and feeling resentful. And so you have to really look at that and see, is that going to happen? If it is, then why? Then you can own your own practice. It doesn't matter. You're still not making what you should. So that's what the thought process behind it. Prices had raised, some of the technology cost more, so it was necessary to raise the prices. And what's really funny is all of a sudden I got pings to my phone from the Spruce text messaging that patients use. Went in elation, tons of messages, and I'm thinking, here it goes. Let me read through this. It was overwhelmingly positive, which was a shock to me, which made me think, maybe I should have done it sooner. But everyone, most of the patients were like, we understand, and okay, no problem here. Or a lot of it was just reminding them, oh wait, I had a medical question. So they didn't even address the fact that there was a price increase. But a good number of them did say, yep, I'm still on board. You're a wonderful doc, or this is understandable, or what's that pricing? What does this mean for me? And we just kind of went back and forth, but I didn't get any negatives at all.
Incredible. And I just love that though, because it's fulfilling your desire to honor your time and to honor your training and your capabilities as a physician. And I feel I laugh because, when Netflix raised their prices, oh, heck no, I discontinued my Netflix membership. But if there's somebody like my legal fees this year went up, and I'm like, I am not going to lose my lawyer because it's so valuable and that person knows me. And so, it's interesting that it's not necessarily the price that I think about when I think of those two services, but I think about the value. And so it goes back to that you're building and you're nourishing community of people who would naturally support you when you do something like that.
Right. Yeah, absolutely. I kept Netflix, by the way.
I recently joined because I couldn't avoid watching The Crown anymore.
Right. Yeah. They know they've got us. So
no, I want to ask about staff. You're talking about, the resentment that you don't want to ever get into. And I wanted to ask, at what point did your practice go through, these are the things that are being overwhelming that I think I can push on just another, that I can bring on another person to handle. What was that? What did that look like for you?
It looks like things not getting done. Because what happens is you don't do the things you don't like to do. And as you see those pile up, when there's less patients, you eventually get to it, you wipe it out, you feel good. And then as you get more patients and that pile gets to higher and higher, and you're starting to feel a little anxious about that pile, you start wondering, should you have someone else to help you do it? It's really a battle though, because you're really balancing how much you're bringing in versus sort of that comfort of being able to push some of the minutia of of the business off on and the practice off on someone else. I would have to say I'm not so sure I would have added staff just yet, but we've started doing a lot of COVID-19 testing, and that's brought in some revenue to the practice, which has allowed me to bring a staff member on. And now, honestly, even if COVID testing stopped, I probably would find a way to keep them. It's so refreshing to take some of that off my plate. And in the beginning, I was just so eager, like I can do all of this. This is no big deal. This is great. But I think to people maybe starting that's going to wear off at some point, and you're still excited about your own practice, but you're not thrilled about, taking care of every fax and uploading every medical record. That starts to get to you, especially when you're still also dealing with other business aspects that you might not be able to pass off to anyone, even if you bring on staff. So if I could do it again, I might find a way to start off with a staff member. I didn't, but I might find a way. I wouldn't, I'd have to really balance that and be careful. But I think if I did it over, I probably would try to start with staff.
Do you have an SOP for your practice?
A what?
Standard operating procedure?
I probably should have that. I think there's probably a lot of things that I probably should have in place. I'm always a little behind and do things probably backwards, I'm pretty sure.
You haven't closed your doors, so I'm going to take that as a win. No, and I mean, you're talking about educating ourselves. It's like you've changed your practice, and you can continue to change your practice, which is, there's nothing wrong with that. So that's awesome. I want to ask, you have an in-house pharmacy, correct?
Yes.
Yeah. And what was the decision, like when you made that decision to have an in-house pharmacy, what were the thoughts behind having one versus not?
Oh, I just knew automatically that I wanted one. I felt like that was something that could set me apart and bring value. I'll be honest, I don't use it as often as I thought. And it may be because I'm solo, that I could probably push it a little more. I basically tell patients if we can get a cheaper price for them, then we'll use the in-house pharmacy. But I was lucky because in Maryland, there's an application that's supposed to be a bit tricky to complete and get approval for. But I had a side gig at an urgent care who required us to have that application filled out, and they did it for me and paid for it. So that allowed me to get my pharmacy, and I was so happy. I think now with staff, we'll probably push it a bit more, display more prices so that people can easily see if they would save money on it. But I definitely think if you can have one, you should have it. It's just so easy, and it really is a convenience, and it is really for some, especially my uninsured patients, they really save by using it.
And how do you handle medicines that are about to expire?
I just throw them away. Yeah, I did. Yeah, it's that was a frustrating point for me as I realized that meds I had bought, I hadn't even used. So now I'm much more cautious. When that first round happened to me, I was like, oh man, I didn't even use these. So now I'm much more cautious about what I'm buying and stocking. So,
Gotcha. In terms of growth for your practice, as you continue to grow, at what point, I know you talked about like the things weren't getting done, but at what point do you feel that you would have a full panel or bring another physician on?
So I, for the talk of, with all the talk about love of medicine, I actually realized that I enjoy creating business, and I've delved into a few other things right now as well. And because of that, and because I see that that's an interest that I have, I'm actually considering capping well before I thought I would, and potentially bringing someone else on. And so that's going to be a little bit different than someone who's sort of getting to a full panel, because I don't think I would consider myself there. Yeah. So I think my situation might be a little bit different in that respect.
I think that's awesome though. I mean,
Yeah.
like, I love that you're an entrepreneur and you're doing whatever the heck you want to do as an entrepreneur.
Yeah. I think I think that's why freedom, it's just, when I say that DPC means freedom to me, because really I would have never done some of this had I been in an employed world. There's just no time, and this is just kind of thrilling to understand that life can take you in different directions, and you can actually go in those directions and not be held down. So
awesome. Yeah, absolutely awesome. Now, you said that you designed your own website. And so I want to ask about that process. What were some of the experiences that you recall from when you were initially designing your website?
It was fun to me. I really enjoyed that. It was the second thing, right? Naming the business, giving it a name and a logo was the first. And then designing the website and getting that up to me was the second. And I remember coming home and doing it after the kids went to bed and doing it on the weekends. And I can whisper this, but, pulling it up in between patients sometimes and playing around with it when I was in my employed job and hadn't let that go yet. It's not hard. And it was just something new to learn how to do. And then the reason why I like that I have my own, and it might not be the most polished website, and I get that, is that I can change it whenever I want versus reaching out to someone, waiting for them to make changes. I mean, I shifted all the time. And I think that's probably why, I like the process that I went through.
I can totally relate. I feel the same exact way. Like if I need to change something or if I don't like the font, I literally can hop onto Wix and change it myself.
Right.
And then call it a day. I absolutely love that. Yeah. So now I want to ask, what is the biggest struggle you've had in your DPC since you opened, and how did you get through it?
I think one of the biggest struggles is that viability. You're at this point where that eagerness wears off just a tad in terms of opening up your own practice. And you are not at a place where you're fully paying yourself. So you may be juggling a few side gigs, which I was just before the pandemic, to make things go. And you start to feel like I could probably burn out from this, right? I'm doing DPC, I've got my side gigs, I have my family. And so it can be a little bit of a scary point if you're not sure where you're going or when the side gigs will end, and are you going to grow? It's interesting, but the pandemic gave me a chance to step back a little bit and reassess that and shift into some additional things that I think have made me more viable. And so I think the slowing down for a little bit is not a bad thing to kind of reassess and understand that everybody's path is going to be different on this. Some people are going to start and blow up and have a great panel right away. Other people are going to sort of be, going to be slow. The churn is a big one too, where you gain patients and you lose them. And I don't think I lost anyone because they didn't like the services. I mean, some people just didn't value the services, right? And understand the importance of it. Or some were just not compliant in the general and really didn't feel they needed to pay for a doctor. So the biggest challenge is just that viability and making sure that you can pay yourself at some point.
And what's the biggest win you've had in DPC?
Oh, that's a hard one because there's been so many. They really are patient related when I've helped someone. So when a patient, after a visit and they said, where they really felt like they've connected with me and felt like now they found I don't want to use the word medical home because they used to use that in the employed world and it didn't mean the same thing, but they found a home where they were going to get their primary care needs met in a way that was respected and comprehensive. And that is probably the best feeling, to know that you're going to provide that for someone and they're going to feel that. That it's going to affect their life, like literally the trajectory of their life. And that's a win.
Awesome. Mm-hmm. And for those of the listeners who want to reach out to you after this podcast, what's the best way to reach out to you?
Yeah, sure. You can call me at 443-574-4439. Or the way to reach me the most direct actually is my email. Because now that I have staff, you actually might reach someone else. But info@resolvemd.org, that goes to me. I'm the one that monitors it. And that is probably the easiest way to reach me.
Thank you so much, Dr. Johnson-Weaver, for joining us today.
Thank you. Thanks for having me.
Next week, look forward to hearing from Dr. Rosana Lastra of Head to Toe Pediatrics in St. Petersburg, Florida. Also, the AAFP DPC Summit is coming soon. It will be held virtually from July 16th to 18th. Learn the ins and outs of DPC practice with hundreds of peers and experts sharing knowledge and resources to help improve healthcare and lower costs. Register at dpcsummit.org today. If you like what you heard today, please leave a review and subscribe wherever you listen to your podcasts. Tell your friends too. For more information on this episode and much more, please visit mydpcstory.com. Also, for the latest in DPC news, check out dpcnews.com. Until next week, this is Marielle Concepcion.